Welcome to Beyond the Limits with me, Matt Clark.
And me, Mike Forsyth. Our loyal listeners will recall our very first episode of Beyond the Limits and the topic of hallucinogens, and specifically psilocybin. We're revisiting this topic in this episode, and this time with a guest, and approaching this from a different perspective. Matt, I found our guest really interesting. Unlike every other guest we've had on the show, he isn't a doctor, and whilst we're used to having discussions about protocols, evidence, this was something very different, with a broader focus on not only an answer to a medical problem, but a desire to look at purpose, identity, and perhaps even a different path in life. I must admit, I found it quite difficult at first. I kept wanting to ask about qualifications, evidence base, and protocols, but actually it was fascinating to hear a different perspective and from someone with lived experience of this process.
Yeah, definitely. I think it was tricky to toe the line here, wasn't it, as doctors? And I think as we all became more comfortable, it opened up. I think he, at times, is describing an incredibly powerful, enormously transformative and sometimes life-changing experience for many people. And these are quite punchy statements. I think at first blush, it would be tempting to consider this as a sales pitch. And we'd be the first to try and disprove unproven therapies without regard to the participants' health for a profit. But interviewing Nigel, he's just struck me as a very warm and considered man. He's certainly not trying to make a quick buck from anyone, nor is he disinterested in the well-being of his participants. In fact, quite the opposite. He clearly believes in the progression and the betterment of his clients. Now, in this episode, we explore the nitty-gritty of what someone could expect from a psychedelic experience, and I think we do a good job of pressing Nigel on the safety of these. And similarly, he does a good job of explaining his protocols and how he manages to keep these experiences safe.
This is clearly not for everyone, so it's important to emphasise that we are exploring this topic rather than in any way promoting it. If you did want to have a closer look at Nigel's work, we'll put his website details in the show notes. I hope you find this episode informative and interesting. Let's get to it.
We're delighted to welcome Nigel Pedlingham to the show. Nigel is a psychedelic facilitator and guide based in the Netherlands. In 2020, he founded Margway, which supports those who wish to integrate psychedelics and notably psilocybin into their pathways of healing and growth. Since 2020, he has supported many hundreds of people in their journey of self-discovery. Welcome to the show, Nigel.
Thank you. Nice to be here.
Very interested to hear a little bit about how you got interested in plant medicine and this psychedelic space that we've discussed.
Yeah, it's been quite a road, quite a slow road, let's say. And that involves the intersection of both personal and professional. Obviously, as a professional in this space, you can't be one without really having that personal connection to the space as well. So for me, it obviously began with my own pathways of discovery, shall we say. I would say I've been on a good healing path for probably 20 odd years now. And a while ago, plant medicines came on my path as well. I'm one of those people who had one of those meetings with the medicine which created a bit of a schism in time, let's say. For me, there was a before and after that particular ceremony. And forever after that particular moment, things changed for me on multiple different levels. And that led me down this road to where we are now. So that was many years before I started working professionally in the space. And then spending more time with the medicines, the time opened up where it became part of my professional suite of offerings, let's say.
You mentioned about this self-discovery many years ago, and I wanted to ask why you've chosen psilocybin. Is that because of personal experience? Is there any other reason why you've kind of founded upon this?
I think as facilitators, we all have to find our spot and our way of working and our medicines. And for me, psilocybin is the plant medicine I feel most affinity with as a guide. So I think first and foremost, it's that. And then you've got various other things involved in the mix as well. And one of them, let's be quite clear about this, is I'm based in the Netherlands and we have a thing around legality here. So we're blessed being here in the Netherlands that psilocybin in the truffle form is legal. So the work that I'm doing and the work that my peers are doing in this space can be done above ground And that creates an enormous opportunity for all involved, for both us as guides, but also in access for other people to participate. So there's both personal and professional decisions made in that choice.
I think you've touched on obviously a very important point there about the legality, and I think that's why we've reached out to learn more about this through you, with your experience using this. I like the way you call it, medicine. We studied in an aforementioned episode, is still one of our most popular ones, about psychedelics and their potential roles in many use cases. We did touch on exploring things like MDMA briefly as part of the research, and how that might be used for PTSD therapy. And then we looked at psilocybin as well and got really interested in this. Or I think I can speak on both of our behalves when I say we got really interested in this, in that its potential use cases in things like treatment-resistant depression and also PTSD. And there's also this other side of it, of things like microdosing and those who are using these active ingredients for kind of health optimization, which is obviously a slightly different use case. But I'm curious to know, out of all of these different use cases, who are your typical participants, and what are the reasons that they're seeking your help?
Yeah, I would say, to categorize in the broadest of sense, we're talking about working with the section of society that are functioning but want to function differently. Maybe you want to function differently, maybe you want to function better. And we're talking about that transition maybe from functioning to flourishing. So within that group is still very wide. What we often hear about, and what you've alluded to, is very much the medicalized end of the psychedelic paradigm, where research is being done, and then the application is being given to patients within a medicalized paradigm, those who have very specific medical needs. And what you've got then, the way at the other end, that's often reported on, and that's historically known, is potentially the recreational use of psychedelics. But then we've got this huge range of different segments within that range. Often those of us in the scene call that the healthy normals. We're talking about the betterment of well people. So within that category, again, I get a whole host of different people coming to me. So for all different needs. There's generally a similarity in the sense that many people will be finding themselves on crossroads in life, wanting to explore themselves, to step into that next future possibility. So there's this commonality of the seeker amongst all of them. Some of them will have some medicalized need around that, and some not. So there's an enormous breadth of people coming into this space and coming to work with me. Yeah, you'll have heard me using the word medicines quite frequently, and that is a word that I and some other practitioners use as a generic term when we're talking about plant medicines here. So we aren't talking about pharmaceutical medicines, and we're talking about something very different there. And it's those of us that maybe come from a more shamanic lineage, or coming from a more kind of an indigenous perspective of plant medicine use, that we then start to use this term medicines to generically cover whether we're talking about psilocybin, whether we're talking about kambo, whether we're talking about ayahuasca. And I just thought it was important to bring that up, because there is some debate from certain parts of the community whether that's an appropriate term or not. But it's something that I feel obliged to use, because we are talking about the world of plant medicine here. And the world of plant medicine itself is also way broader than just those that are psychedelic.
What can a participant expect when they work with you, Nigel? So is there a typical structure that you will follow, that they will go through as a rule, or is it more an individual approach depending on what someone is looking for?
Yeah, I think with so many of these questions, we're going to get both of those in a sense. But yes, there is a program. I work very much with a programmatic framework. So what this isn't about is just, like a single drop in and sit with the shroom, let's say, and then leave and hope everything is going to change. We're talking about a programmatic intervention here. And what I said, I work with people through the 3 core phases of transformative psychedelic work, and they are the phase of preparation and connection, of immersion, and then integration. And all 3 of those are really vital components of any transformative psychedelic experience. So The preparation is about getting the participant ready to, one, be entering the psychedelic experience, but two, to have spent a period of time in connecting with why they're even embarking on this experience. So we will work together typically over the space of a number of weeks, if not months, to unpick this. So I have a program which supports all of this. It's a modular program which has these 3 core phases in it, where we would spend a good period of time in that preparation phase working together and the participant working on their own to really sit with these questions of the why now, what am I doing this for, where am I at in life? And there's a whole suite of help that helps people with that. And we would meet a number of times as well to have sessions before any form of psychedelic session. You're also in that phase talking about the preparation on that mind, body, spirit level as well. And what we're often in psychedelic terms here, we're really referring to the set. You might have heard those terms set and setting, but the set and setting really is the kind of the mantra of the psychedelic space to enable kind of transformation. And the set is what happens before. It's all about your mindset. And the term will be very familiar with mindset, but then our mindset, our body sets, our heart set. How are you in yourself? And what is your readiness to go into the psychedelic experience? And then you'll hear that term setting, and the setting is the setting in which you are experiencing the psychedelic experience. So then someone would come to me and we would host ceremony, and you'll hear me often refer to the term ceremony because these are ceremonial programs, and the ceremonial aspect for me is a vital one. And then the phase that comes after the psychedelic experience is an integration. Equally important, what do you do with the insights that you experienced? How do you make sense of what happened? And how do you work to become the embodiment of the insights you experienced?
And is that based on any pre-existing program or structure, or is that something that's been born out of your own experience and the experience of your colleagues?
Yeah, I think the set and setting now is really kind of, is a let's say a term that all of us that would be working in the space would be very familiar with and use. And those 3 phases are also something that everybody who's working for in the transformational space or the healing space or whatever we want to call that, they are the standard phases that I would expect everybody to be working with, because one without the other leads to a lack. And that's often what we're seeing in the space is this: there's so much expectation around psychedelics that it can often come in an unconscious sense with that expectation. I can go somewhere and I can have this plant or this fungi or whatever, and that's going to be it, and the problems are going to be over, and we're plain sailing into the next phase of life. And sadly, that's not generally how it works. And the good integration is about preparation, and good preparation is also the awareness that one will have to integrate afterwards as well. And then just being also prepared and ready for the enormity of the experience that you may be going into. So those 3 phases are quite critical. Everybody who then works with those 3 phases will then bring their own nuance to them, their own approach. You'll have people who maybe come from a more medicalized leaning, and then you'll have maybe who are coming from a more shamanic leaning, and everything in between that. So there's going to be a whole breadth of different offerings out there that will appeal again to different people for different purposes.
I think to dip into the kind of medical side of things, in the way I'm thinking about this at the moment, is that we studied how these medications can cause this neuroplasticity and this allowing of these new connections to be made, and how there's theories about this kind of decoupling of the executive mode function versus the default mode network, and how they might be misfiring at this or concurrently running at the same time, and how these psychoactive substances might allow people to kind of think about things in a new way. So I think it was really interesting to hear you say how you run a bit of a course, and obviously you're a guide, and how a lot of those words sound to me they're providing almost a path for those medications to to act while also kind of guiding patients through those experiences rather than just allowing them to have, these new routes and these new explosive pathways that might lead to misadventure. Now, I just want to just bring it back a little bit because you mentioned something interesting at the start about how there's a spectrum of people who might attend. But I'm just curious to know, appreciate it might not be overtly apparent what medical reason why they might be presenting, what trauma they might be holding on to from childhood, what it is they're struggling with psychologically. But I'm just curious to know, do you have any examples or any themes of people who kind of reach out for your help?
From a very generic perspective, there is just that knowing and that want of something different, and knowing that you're at that point where you want to create a shift in life, whatever that might be. The shift itself can have multiple facets, but it's more that knowing of wanting to shift into something new, a new version of yourself. And then under that, you could have a list as long as your arm in terms of themes around that. I'm 52, so quite a few of the people that are coming to me who are necessarily around my age are reaching that phase of empty nest syndrome and moving on to the next phase of life. Who am I? What have I been doing with myself the last 20 years? Or I know what I've been doing with myself the last 20 years, and now that's not my principal role anymore. What am I going to be doing next? So we might explore that. It could be someone's coming because they are generally very stuck in the world and in life, and we will explore where that stuck's coming from and what's next. It could be that someone has been suffering from mild depression and an inability to function in life, whether that's work or relationships or life, and we might explore that. The breadth is quite wide. You often see a commonality between all of the themes, like an underlying commonality.
Thank you, Nigel. I very keen, as you would imagine, to ask about the safety profile here, and specifically how you ensure that this is a safe process. I guess I wanted to touch upon a couple of specific risks that come to mind, but I'm assuming this is a big part of what you're doing.
Yeah, absolutely. Yeah, safety is paramount.
So to go on from that, certainly my understanding of this is that when we're talking about the risks of psychedelics, particularly psilocybin, whilst the feeling is that it doesn't in itself lead to psychosis, we know that can be a risk in those with pre-existing predisposition to psychosis. Potentially, if there's a strong family history, that might increase risk as well. Is that something that is addressed before any treatment is given? And is there any kind of pre-vetting in terms of medical history? And do you ever turn anyone away?
Yes, and yes, I think would be the quick answer to all of those. I know when Matt brought this topic up and we were talking before this podcast and he broached the subject of safety, I was like, yes, please, let's talk about this because it's really important. And there is, as we see the psychedelic awareness building, and not a day goes past where there's not something in a newspaper somewhere or a new documentary on Netflix, there is this building awareness of psychedelics and their potential for healing. And there also is this building of need and expectation around it, and a rush to access help in this way. And with that, if one rushes too fast, both as a practitioner and as a potential participant, there's the potential for harm to get in there. So harm reduction is an extremely important thing for all of us who work in the guiding space. And then minimizing risk and undertaking appropriate health and safety checks. So any guide who is doing this, who is a professional guide, would have a screening process at the very beginning of any potential client or participant relationship. I, for example, will always start with any potential participant in having a call with them. I will never work with anybody who I've not met, let's say, and seen through the eyes and spoken through the heart, because that is the beginning of the relationship. The bond of trust that goes on between a guide and a participant in this space is absolutely fundamental. So I would always start with what I call a discovery call, where we would have a bit of time for the participant to tell me what they were looking for and for me to tell them what I can offer. And I can also sit there and feel, do I feel that I can support this person? If I can't, for example, maybe I can refer them to someone else. And then the first imperative stage that would come after that is screening. So there would be a detailed screening process that any participant would be required to fill in. And from that, an assessment can be made as to whether this is safe to progress. And yes, I have said no. I've said no to people before we've even got to the screening process. If my inner guide is saying no, then generally it's the right answer for. And then obviously when it comes to the time of screening, there could also, there could be contraindications which come up, which means that this route of healing or development for this person isn't suitable for them. And there's a nuance to those words there. We're not saying that they aren't suitable for it. We're saying that it's not suitable for them. And that's really important. And then from a community's perspective and industry's perspective, we've got checks and balances placed as guides to enable these spaces to be as safe as possible. And one of those would be, just to give you an example, would be here in the Netherlands, we have an association called the Guild of Guides, of which I'm currently the chair. And that is the association for all facilitators of legal psychedelic experiences here in the Netherlands. And that is there as a means for participants to access experience guides, and also for the guides who are in the space to skill up to a level, to as high a level of professional expertise as possible.
And do you need any particular qualifications from that guild? How do you get approval from that? Do you have to put applications in?
Yeah, there's an application process to come in for it. So as any guide who would want to join the guild, there are membership criteria that you would have to meet, and there is a vetting process to join.
And then you mentioned obviously that sometimes it's actually a feeling that you get in yourself that you aren't the right person for them, or this isn't the right thing for them to be doing. Are there any absolute contraindications there whereby any pre-existing medical conditions or anything else immediately precludes someone from partaking, or is it more based just on a feel and and whether there's a connection or a good feeling from yourself?
No, there's definite contraindications which would really create an inquiry as to whether this would be a safe and ethical thing to pursue. You mentioned them yourself, Mike. If someone has a history of complex mental health, for example, so if there is schizophrenia in the family, for example, or if you have had a psychotic episode in the past, those are contraindications that you would have to investigate further. It's not a hard no necessarily in all cases, but it would be a flag that you would have to investigate more and find out more information. Likewise, if people are on certain medications, you would also want to check out the contraindications of certain medications against certain substances.
I'm keen to dip into the nitty gritty. I'd really like to know, I guess, how much does a participant take of the truffle on an experience? How do you calculate that? And also then how deep is this experience? What level of kind of psychedelic experience do you observe, and is that variable?
Oof, there's a lot to unpack there.
Mm-hmm.
He never asks easy questions, Nigel. Sorry.
Let's start with that last one first, because I think it's easier to give you a vague answer, because there is you can't categorize the psychedelic experience. It's impossible, and this is one of the challenges and the wonders of this work, that every experience that happens is quite unique. And just as a participant as well, or as someone who is taking, let's say in this case, psilocybin, you could come and work with me next month, and you could have a particular form of experience, a form of process. And then if you came again in 6 months, it would be completely different. Sometimes they can be you can have a participant who's extremely still for the entire experience. Sometimes they can be extremely mobile. sometimes very quiet, sometimes very vocal. Sometimes it can be a very cerebral experience, and sometimes it can be an extraordinarily physical experience. So you never know what's going to happen, both as a participant and a guide. But that's, again, that links back to what we were talking about right at the beginning, and that importance of the preparation phase, because you are then preparing yourself for the unknown. Another question you asked there was, what sort of level of psychedelic experience are we talking about here? I heard you talk right at the beginning, you mentioned obviously a microdosing. So we're not, in this case, with me and the work that I facilitate, we're not talking about microdosing. That's a completely different approach and a completely different thing, and that would potentially warrant a conversation all on its own, to be honest. What we're talking about here is usually higher dose and deep dives, so you're very much going inward. A typical way of how this would look is that once someone's arrived and once we've settled and once we've gone through the ceremony and ritualistic opening of such a session, is that once you have ingested, in this case, the psilocybin, you lay down, you have an eye mask on, and you're really guided to be going in. So we're not sitting there and we're not talking. This is, again, the difference between the psilocybin approach and, let's say, the MDMA approach, which is often done and we're talking about MDMA therapy, you're often talking under the influence of that particular substance. Whereas with this, we're really guiding you to go in, to really be going into the inner realms and exploring what's going on there.
And I think that goes back to, I know when we look about the safety profile, it's having that controlled environment and having someone who knows what they're doing, to put it bluntly, in terms of safety profile, that actually the dangers are when it's unregulated, when it's not supported, and it's just taken, whether it's recreational use or otherwise.
Yeah, and so much, like you'll have heard, and I don't know whether you spoke about it in the last podcast or not, I don't remember, but that concept of the bad trip, and the bad trip is often a result of bad planning, in the sense that you haven't prepared yourself for the enormity of what you're going in for, and when you move into an altered state of consciousness, it's quite shocking if you're not prepared for that to happen. So if someone has just given you a substance that you've got no experience with, and all of a sudden you are in that altered state, that can trigger a panic, that can trigger various different reactions to being in that state. Or likewise, if you find yourself in a setting which isn't conducive for doing something like this. So if you're just walking the streets and all of a sudden you start tripping and you're in the middle of, a huge group of people, that could be quite triggering. So this is, again, why we're creating that safe container for you to be able to be as safe as possible, as held as possible, to minimize any form of external disturbance, so you're able to focus on the internal realm that you're exploring.
And just to take the safety profile question a little bit further, and it's really just playing devil's advocate here, but what would you say to someone who would make the argument that strong hallucinogenic substances used on potentially vulnerable individuals, and I mean vulnerable in the sense not necessarily from a medical point of view, but from a position where they are searching for something and are maybe a little bit unmoored in their lives, that this should only be, considered by experienced psychiatrists, mental health professionals? How would you answer that question?
The word that's coming up for me here is ethical professionalism, and as practitioners in this space, having that very strong ethical compass is paramount, and that's where this whole space is so interesting. A market starts to become more active, and people start talking about reaching market and all those kinds of things and scaling up. That's when things can somewhat start to get a bit clouded in this. If you're having to chase a bottom line on a financial bottom line, that's maybe when you want to accept any form of participant that will come through the door because you have to fill your retreat center or whatever it is. And that's when these ethical frameworks have to come in. And that goes back to that point where I said at the beginning, if I was to have a discovery call with someone and I was to sit there and think, that I don't feel that person should be either going into this experience now, or that I don't feel that I could support them, then I would already stop that process. That's obviously not to say that they're not going to pick up the phone and go somewhere else, which absolutely could happen. But again, we've got to move away just from the rhetoric around that psychedelics are therapeutic agents. If you're talking about the section of society that really need a medicalized approach, then they should be going through the medicalized support that's on offer to them. But we've also got to consider the historical and cultural use of psychedelics and plant medicines across the world, and how there are many people that can access those who can safely and ethically do so.
Just rounding it off, this might be a quick point, but you mentioned about being the chair of a guild, and it's great to hear that there's structures in place in countries where this is legal that we're obviously unfamiliar with and unaware of. But we read some kind of slightly harrowing reports about elsewhere in the world where, you know, there's clinics who are running these therapy sessions, let's call them, where they might be using a psychoactive substance, and that it's actually opening patients to some form of abuse. You told me I think on a phone call prior to this call that you might record the experience that these participants have. Is that right?
With clients' permission, I always record them from a sound perspective. So I'm not videoing them, because that to me is maybe one step too far. But from my own perspective, I make a sound recording of all of these sessions for two reasons. One, if it has been a particularly verbal session for the participant, it can be very useful for them to have that back for them to listen to reconnect for their integration. And two, we do it for integrity's sake. So we do have a recording if it was ever needed to rely on, if anybody, if there was a differencing of opinion of what went on in the room. It's really important because both parties are moving into a vulnerable space. And that takes us back to that word of trust. And that's why the building of trust and the building of rapport between a participant and the guide is so vital.
Sorry to keep you on this, Nigel. I was just going to ask about something that occurred to me was potentially I don't know if you'd call it a societal risk, but the feeling that potentially that there might be participants here who are turning away from traditional evidence-based treatments for medical issues. And I do appreciate, we've said all along that this is not just people with medical problems who are coming, but are the participants who have medical issues, are they carrying on with ongoing treatment, or is it a case where they have actually turned away from that and are looking for something different?
Possibly looking for something in addition to, rather than instead of. We're talking about an holistic approach to well-being here, and often involved in that is whatever we want to call participants, clients, patients in your perspective, maybe taking some agency back over their health, but not necessarily at the detriment of what else is out there. So I'm not sitting here prophesizing that this is the way forward for everybody and forget everything else. This is one potential means in a host of other means, and that's what you're doing on this podcast, isn't it? Exploring all sorts of different routes to health and well-being. And I don't think any of those practitioners would say it's this route and only this route. It's this. And a lot of this work is done in parallel. I may be working with someone who is also having traditional psychotherapy. And that doesn't mean that, I'm better than the psychotherapist or the psychotherapist is better than me. It's just that that particular participant has decided, either on their own or with the understanding of their therapist, that this is an additional and helpful route. So we would then work in parallel with each other. The psychotherapist and the client are working together, and then we work together as in kind of in three lines, and then my bit comes to an end, and then they go back into the care of their therapist.
I feel like we've pressed pretty hard on the safety aspect of this. I'm curious to know, how long is a ceremony typically? But after that, what is the follow-up? What do is there any follow-up? How do you kind of guide someone after this experience?
Yeah, good questions. So the ceremony that I call it, some other guides will call it a session. It depends on your modality and the way you work. But I'm a ceremonialist and ritualist here, so I'm big on ceremony. A whole day. Typically, it's about 8 hours. So a couple of hours landing and doing various forms of exercises, sharing, the ceremonial opening, and then you're in the psychedelic experience for a good 5 hours. And there's generally, that's where you do get a standardized psychedelic experience with particular medicines that you kind of go through these different phases of those 5 hours. And then after those 5 hours, generally people will start to land and come back. But you're still very much under the influence of the medicine for the rest of that day, for example. And that's why aftercare is so important. So I alluded to that right at the beginning when we talked about those three primary phases of preparation, then immersion, and then integration. So the aftercare and integration that comes after the psychedelic experience is extremely important on a number of different levels. One, you've just got general participant aftercare. How are they doing? How are they on a physical and emotional and spiritual level in the day and the days afterwards? So how that works is always having the first integration call, for example, the day after, or meeting, preferably, where we will sit and gently begin to explore what happened during the ceremony, but also more just doing some basic self-care there. What's going on? How are you? How are you feeling? Everybody, again, in the days afterwards is going to feel extremely different. So we've got this gentle aftercare and gentle integration in the immediacy in the day or days afterwards. And then generally with my programs there's usually then a window of about a month afterwards where we're still working together. And that's generally the if we're going to bring this back to some science talk as well, that's generally the period of time when we are in that very neuroplastic sense. So in that time, there is that opportunity to take advantage of this neuroplasticity, and it's also the time when we're most open emotionally and spiritually, and so in that time it's important to be connecting with the experience. One of the biggest challenges with this work from a participant's perspective is the going back and integrating into normal life. So you can have come and you can have had this experience, but then you do have to go home. You do have to go back to being a parent or a colleague or a carer or whatever it is. And one of the biggest challenges is then how do I stay connected with what's going on with all of the challenges of everyday life? So that's where this integration phase is really important. So I support my clients through that phase with guidance, with guides, with then check-in moments, sessions. So there's a very detailed integration phase that comes after any session or ceremony.
It's interesting to hear that the intensity of the structure afterwards and how important that is. It has actually made me think, do you have clients who go away and then in 2 or 3 weeks' time or 2 or 3 months' time who are emailing going, Nigel, gosh, I need to have some more of this medicine? Are there any people who are seeking this on a kind of daily basis or saying, gosh, this is better than my role as a carer or a father, or I hate my job, I need to kind of dip into this psychedelic world more? Is that a risk or a problem you've noticed?
I wouldn't expect to have people coming back saying, right, I want to do this every day. If you've done this, the level that we're doing this at, generally it's hard work. So these substances generally are not dependent substances like that have addictive properties like many other chemical substances, but there can become a dependence on the experience itself, for example. So if someone was to come back to me and say, right, we need to do this again, for example, we would have a discussion as around the why. So there's very clear guidance given, for example, in part of the preparation phase, that no enormous life changes should be made in the ensuing weeks after such an experience. There needs to be time for the dust to settle. There needs to be time to sit with the nuance of what happened, because often the messages that you get under these experiences aren't quite as literal as they may first appear. So if someone after a while is saying, I want to explore this more, then we would explore it, but through the through the container of integration sessions, not through jumping straight back in necessarily to another psychedelic session.
Thank you, Nigel. That's really interesting. It did occur to me that I did wonder about whether actually participants might go away and look at life in a new way, and whether that might trigger huge life changes that may have unintended harm perhaps to others. But I know we've asked you a lot about the risks. I actually want to just flip it for my final question and ask about the benefits and really what benefits you personally have observed in your practice. I'm assuming you get feedback, you get people getting in contact to you to talk about what they've experienced. What's your lived experience there?
Yeah. Well, again, everyone's experience is vastly different, and I think it's very important to bring that in, because around this level of expectation, which comes with the booming of this space, there comes the booming of expectation and this concept around the magic bullet, right? That's not how it works. So the experience can be enormously different than what you expected. And that's again where the integration becomes so important, in sitting with what it was and spending the time to unpick it. Yeah, how to answer that question is often about telling stories, but I'm very cautious about not going into the details of individual client experiences. But yeah, I've witnessed enormous transformations. Some from the enormous, some down to the very subtle. But the subtle ones are as important as the enormous ones. And often, again, this is where that adage of slowing down and really connecting with the process is so important, because often many of the teachings and many of the learnings are really subtle, and it really takes time and nuance and dedication to see them, feel them, and start to live by them. So that's a complex question you asked there, Mike. But yeah, we're doing this work I am doing this work for transformational purposes. But again, that word transformation can have very many. You can take that word and define it very differently. What's transformation for me is very different than what's transformation for you. But I've seen many people who've been able to make just very subtle changes to behaviors or ways of showing up that have had what they've had to do has been quite small, but the ripple effect of that is absolutely enormous. And then for some, there are enormous things that happen straight away. The recognition of something that is utterly transformational.
Okay, Nigel, look, I'm going to wrap things up there, and I want to thank you so much for your time. You've been very generous with your time. It's really been interesting to hear your insights and experience. I think it's important to emphasize that you are practicing again in the Netherlands. This isn't legal in our country where most of our listenership is based at the moment. But it's been really interesting. This is a topic that is fascinating in terms of the unknowns here. These, whether they're medicines, psychoactive substances, whatever you call them, they are certainly unknown, and I think that the developments in this space is interesting, and Mike and I have taken great interest in our previous episode to explore this. So it's been great to have your insights into that, and I want to thank you for your time.
Thank you. It's been a pleasure to be here.